Hi everyone, welcome to Nursing Wisdom at R. Today let's move to the topic called gastritis. Gastritis is the gastrointestinal condition in which it is the inflammation, irritation or erosion of the lining of the stomach. The lining of the stomach is also called the gastric mucosa. Let's go gastritis very broadly. The stomach is having a protective lining of the mucus, which is called the mucosa. This lining protects the stomach from the strong stomach acid. This strong stomach acid is nothing but the HCl, which digests the food. When something damages or weakens this protective lining, the mucosa becomes inflamed or causes the gastritis. This gastritis is caused by some of the bacteria like H. pylori. It is also called Helicobacter pylori, which is the most common bacterial cause of the gastritis. Let's move to the types. Types is acute and chronic gastritis. Acute gastritis is lasts for several hours and few days. Chronic gastritis which lasts for long lasting. And let's move to the etiology of the gastritis. Etiologies such as the bacterial infections. Bacterial infections I have already told, H. pylori. And next etiology is the intake of medications such as the NSAIDs. This may lead to the gastritis, and intake of alcohol which leads to the gastritis due to stress, also due to cocaine, and some of the treatments such as radiation and chemotherapy which leads to the gastritis, bile reflux disease and autoimmune, and mostly common is regular use of pain relievers which leads to the gastritis. I hope you understood the etiology of the gastritis. Let's move to the signs and symptoms. Signs and symptoms of gastritis as black and airy stool, like the color of the stool will be black and there will be the bloating and there will be the feeling of nausea and vomiting, and mostly there will be the feeling of fullness of stomach after a meal or after having any kind of food. There will be a loss of appetite and there will be stomach ulcers and losing weight without meaning to. There will be a pain in the upper abdomen and discomfort too, and there will be vomiting blood, and mostly there will be an indigestion. You can see here in the diagram, this is a healthy stomach and the stomach which is inflamed with caused by gastritis. This is the HCl which is increased in the HCl in the stomach. I'll explain in the pathophysiology. Due to any cause, like due to any etiological factors, I have already told etiological factors like intake of alcohol or intake of NSAIDs or any treatments, radiotherapy and all. All this, because of these etiologies, the barrier get penetrated, inner layer get penetrated, and due to hydrochloric acid comes into contact with the mucosa, there will be an increase in the HCl in the stomach and it will come into the contact with the mucosa, and after getting contact with mucosa there will be an injury to the small vessels in the layer and it leads to the edema, hemorrhage and possible ulcer formation. The ulcer formation which is formed in the layer because of the hydrochloric acid which is come into contact with the mucosa, this ulcer is called gastric ulcer also. Let's move to the management. I hope you understood the pathophysiology of gastritis. Let's move to the management. Management is medical management. Antiemetic drugs like domperidone, in which antiemetic drugs are given, like there will be a vomiting in the person, and antacids like ranitidine is given because to relieve the pain, and antibiotics is also given because there will be a bacterial infection. And nursing management should are the administer IV fluids as ordered by the physician, provide antiemetics, I have already told if the patient is vomiting, provide a bland diet, administer antacids, monitor patient's fluid intake and output, administer pain medication because there will be a severe pain in the abdomen, assess the patient for presence of bowel sound. I hope you understood this topic gastritis. Thank you.